The service is called the Breast Radiotherapy Injury Rehabilitation Service, and it's a service designed for patients who've had breast cancer treatment, radiotherapy as part of that treatment, which may have damaged their brachial nerve. The symptoms of that would be loss of movement in their arm, in their hand, a lot of pain. Also, they might have low mood. It would have affected their quality of life and their day-to-day living.
The technology we have nowadays is so sophisticated that problems associated to radiotherapy are relatively rare. When radiotherapy was different to how it is now, some people did experience problems with it. The common symptoms that people start to experience is a feeling of pain down that arm. In addition to the pain that people can experience, there'll be a range of other symptoms. That can include a feeling of tightness in your chest or a bit of breathlessness, a thinning of bone on x-rays. You may get excessive swelling in that arm, and of course all of these will make you feel somewhat anxious and depressed. That's very normal. The Breast Radiotherapy Injury Rehabilitation Service has been set up for people who experience these symptoms after they've had treatment for breast cancer. The service is free for those living within England, and referral is just either via self-referral or from your GP. For those people who live outside of England, they'll need to get approval from their local authority. Feedback that we've had about our service from the patients who've attended so far has been extremely positive. People have said that they are able to better manage their pain. They've got improvement in the range of movement in that painful arm. And they generally feel as if they're more in control of their symptoms, that their quality of life has improved. Of course, nobody should feel put off having radiotherapy treatment because of the tiny risk of developing these types of consequences. Instead, please feel reassured that you'll be cared for appropriately before, during and after your treatment.
Before I heard about the service, I was feeling rather low. I'd been told that I'd got plexopathy and that I knew from a few years previously that it was progressive, but I'd been told that virtually there was nothing could be done. Go away and learn to become more and more right-handed, and that was really it. I think the most upsetting thing for me was when I found I couldn't hold a fork and I couldn't bring the fork to my mouth.
Once the patient has been referred to us, an initial telephone assessment call is set up. We go into medical history, what has happened to the patient up to this point, what their symptoms are, and what is important to the patient, what their needs are and what they would like us to address in the clinic. This helps us really tailor-make the day to suit them and to meet their individual needs. What makes this service really special for patients is that we have professionals working together from lots of different areas such as pain, cancer management, respiratory, which is breathing disorders, and they all come together to treat the patient as an individual.
The treatment was excellent. To have a one-to-one meeting with different specialists in their subject. And I was very surprised to hear that only 20% of my muscles at that time were working. How would I feel if I could have 15 to 20% back? And I said, yes, that's 100%, I'll have it, thank you.
Once patients come to clinic, they are immediately relieved and reassured that they are with people who know about their condition, and they also get the support of other patients who they've probably never met anyone with the same condition as them. Once patients have been through clinic, they will receive a follow-up call from the specialist nurse at each centre.
I've now got movement in my hand that I didn't have. It's positive. I feel that it's going to be better.
We're constantly improving our service based on patients' feedback, and referral is just either via self-referral or from your GP. If what you've heard makes you think that this service would be useful to you, then I would encourage you to go and see your GP and talk about a possible referral to us.
To get a new lease of life, as I did from coming to the clinic, is just magic. That's my word, magic.